It's super important. I mean, I think it's of primary importance.
With refugees expected to come to Canada from Ukraine in the weeks ahead, one Winnipegger is starting a private database of healthcare colleagues willing to take on refugees as patients. Russia's unprovoked war in Ukraine has killed hundreds of innocent civilians and has turned cities into rubble. Millions of Ukrainians have fled the country, fearing for their lives. Now, Canada, just one of the countries preparing to welcome refugees looking for safety.
We need to be able to get them to the proper health care if they require.
Dr. Adrian Havaleshka says when the refugees arrive, they will need medical support. So he's working with the Ukrainian Canadian Congress and coordinating a list of health professionals that would be willing to take on these refugees as patients.
The best way would be to have a contact person for health care with the Ukrainian Canadian Congress, which can reach out to these to the offices, the office managers, the doctors, and a relationship can be established. And then when a refugee is in need of some particular thing, say their tooth hurts or their child is sick, they contact that number at the UCC, and they call the office that they already are known and familiar with, and it might be a quite easier process to do.
Havaleshka says he's had numerous healthcare professionals reach out to him who are interested in helping out.
While we do have a fair number of Ukrainian physicians and dentists stepping forward, I am overwhelmed by the non-Ukrainian, non-Polish, non-Russian speaking medical personnel that have reached out to me.
Havaleshka has been to Ukraine numerous times, particularly going on 3 surgical missions with the Canadian-Ukrainian Foundation to help heal wounded soldiers after Russia annexed Crimea. Havaleshka says the West needs to step up its medical supply to Ukraine because there are many medical issues beyond wounded soldiers and civilians.
What about the chronically ill? What about the incapacitated that can't move? What about the pediatric cancer patients who are now, thank God, some of them, I believe, just were transferred to Toronto, and some went to Poland. What about the newborns with heart ailments that would have had surgery in Kyiv but now can't? What about the psychological issues that come out of this? They're going to need a whole lot of help.
In Winnipeg, Alex Karpa, City News.